Hello, everyone. Jonathan here. Actually, no, that's not true. Jonathan wouldn't speak. The ophthalmologist, Jonathan, somewhere in the back, taking care of the rest of my life while I do this. It's so good to see you all. Thank you all for being. I assume you all can hear me just fine. I think this is the first time I've done a live, maybe that actually I got to use my podcasting stuff. Like I got my microphone here. Wherever you are, welcome. Oh, we got Portugal. We got someone's already asking for corneal abrasion tips. My God, you must be in a lot of pain right now. Maybe we'll get to that later. All right. It is 12:30 on the West Coast, and I tried to pick a time where the most people out in the world would be able to actually be able to be here and listen and enjoy this. So it includes all the wonderful people out in Europe. I'm sorry to all my Australian followers. It takes a lot of brain strength to try to figure out what time it is there every time I try to figure that out. So 12:30 a.m. in Pakistan. Oh my gosh. Okay. Thank you all. It's a pleasure. I love being able to do this and seeing all of your messages. Uh, and man, everyone's chiming in from all over the world. This is fantastic. Okay, as you can see, I've set up some props, some things, some very important things in my life to be able to for y'all to look at when you're if you ever get bored and you're tired of looking at my face and you want to look at my other faces, you could do that. I got my nephrologist water bottle up there. Uh, the corporate malfeasance award for United Healthcare, and I hope you're all enjoying the videos. Uh, and so, what I thought I'd start out with is just let's do a little recap of what's been going on. I know we got a lot of people that are not from the United States that are watching right now. I hope you're enjoying learning about the fiasco that is United, or not United, United States healthcare, our healthcare system here, and our health insurance and all the things. Um, so I know it's depressing. I know I've put you through a lot over the first 2 weeks of this month, and that's purposeful. I don't take this lightly. I don't mean to depress you all at whatever time and whenever you watch my videos, but it's reality. To be honest, the reason I wanted to do this is because I've been doing videos every so often about the healthcare system. I'll put one out like once a month or so. I wanted to do just a lot. I wanted it to be relentless. I wanted it to be once a day for a whole month just to really drive home how messed up this whole thing is. And I feel like that's coming across because I'm getting a lot of messages, a lot of emails of people who are just figuring all of this stuff out for the first time. And that was the goal. That's the goal to just every day show you something else that's that's wrong with this healthcare system. Show you something new where people are being taken advantage of, patients, doctors, the people who are actually working in the healthcare system being taken advantage of. And so now we're 2 weeks into it. We've covered a lot of different topics. I started out real basic, talking about, premiums and deductibles and copays and coinsurance. And got a little silly at times with, some, I featured paramedics doing the surprise billing thing and talking about physician owned hospitals. And today we had, what was today? I don't even remember. Oh, payment processing fees came out this morning. And what's been really interesting to me is just how many people are like, I had no idea this was a problem. I had no idea that the No Surprises Act left out ground ambulances, just because it was just kind of hard to figure out. And so, and that was my initial goal here is education. Like I want to try to make you laugh. Like that is a goal that I wanted to do, but I also wanted to educate you all and try to teach you something about why the system is the way it is, why you're frustrated about this bill or that bill, and so we all learn together. And you guys, I'm learning just as much. Before I started this, I honestly did not even know that physicians were not allowed to own hospitals, and that a lot of that is just because of lobbying on behalf of huge hospital corporations like HCA or the American Hospital Association. And the end result is now all these hospitals consolidating and decreasing uh, choice for patients, driving up prices. Like I didn't know that was an issue, and so I'm learning about this as I go along. I've got 27 of the days, all the skits written out. I just got to start filming some. This morning, you'll be happy to know I filmed a skit featuring the rural medicine group and another of your favorite character. So, or maybe not actually. But anyway, so you got a rural medicine video coming up tomorrow. I'll give you a sneak peek. Um, Tomorrow morning, the neurologist is going to take on United Healthcare. All right. I saw somebody mention that they wanted to see the neurologist. Well, just you wait because, spoiler alert, he's not happy. He is not happy at all. And so you can be looking forward to that. I haven't been keeping up with all these messages you guys are sending me. All right. Thank you all for all of these wonderful comments. I appreciate all the support. And that's the other thing. Like, I didn't know how this would go, whether people would keep watching these videos because they are, they're not like the happy go lucky, fun videos that I typically do. Although a lot of my content does have like an undercurrent of just pain and suffering. That maybe that gives you a little sneak peek into my personality, but so it's not as lighthearted as I typically try to be. But I wanted to do something I think is important, and it's been on my mind. As the further I get into my medical career, the more I have become aware of all these things, and I feel like I have a way of explaining things that actually helps people understand them, and also if you can laugh just a little bit, a little smirk, a little forceful exhale through your nose, whatever reaction I can get, so long as you like finish the whole video. That's really my goal. So thank you. Let's see, Nurse Reed RN. Hi, Nurse Reed RN. Thank you for being here. And let's see. Oh no, YouTube keeps burying me in your feed. You have to go searching for me. Yeah, I'm not like Mr. Beast. I don't like, uh, you know, try to scientifically figure out the algorithm. You guys, I just post things. I'm not, I could probably do a better job of like figuring out how to like you doing all like the fancy thumbnails and stuff. And we do that for the podcast, but that's mainly because I'm not the one doing it. I just post. I have a poster's heart, and I just want to get it out there. I don't know. So maybe I could try to fix the algorithm in my favor, but I don't know. You're just gonna have to search for me, I guess. I don't know. Word of mouth. That's how I like to grow, I suppose. Thank you all. And oh yeah, feel free to like this thing that's going on. Bring more people into it. We got 630 people here so far. I appreciate you all taking some time out of your weekend. If it is the weekend where you're at. Again, Australia, I have no idea what day of the week it is for you. Um, Thank you for how am I doing, guys? I'm doing fine. I'm doing. It's this has been a it has been a tough month. Like posting this much, it's a lot of work. Even though the videos are like a minute and a half, 2 minutes long. It's been tough work, but also very rewarding. So A couple things I want to talk about though about this series, and as I'll try to monitor this this little thread here and see if any questions pop up for me. I'll try to answer them as we go. Oh, Aussie. So in Australia, it's early hours of Sunday. All right. Well, there you go. Who knew? Okay. So we talked about why I'm doing this. I want to try to create as much conversation around these topics and as much education for not only healthcare professionals but also the general public. I want us all to learn about this stuff together because we all need to know what's going on with our healthcare system. I appreciate all the. What's also great about this, by the way, and the reason I love doing these videos every day is because every day I get hundreds of comments. I may not get as many likes or as many views as I do on my other videos, but honestly, that's okay because I'm getting much more of the comments. I'm getting a lot more comments on these videos than I am on any other videos I'm getting. It's interesting. And that's because all of you have your own stories to tell about the healthcare system. And that's a huge part of this. People listen to narratives. Narratives are important for getting your point across. That's why if I have a lesson I want to tell about the No Surprises Act, I turned it into a story because people listen to stories, right? So I love seeing all of your own stories about the topics I'm discussing in my videos. So keep commenting, please. I don't care how many views I get. If I get 100 views, but I get 1,000 comments, as long as I'm not being canceled, because that sounds like someone being canceled. But it doesn't matter as long as it's just tell your stories. All right, get your experiences out there. That's very important. Turkish Ali, why no plastic surgeon yet? I don't know if I've ever actually met a plastic surgeon in real life. So that's it. Is a veterinarian going to come up in the next couple of months? Good question. I got to do a little bit of research to figure out things about veterinarians and figure out how they can overlap. I think the natural place for them to overlap is probably rural medicine because you could have like a vet who's doubling as a human doctor as well. I don't know, just because of scarcity. Who knows? Um, okay, moving on. All right, so we talked. So comments, yeah, keep doing that, please. Thank you, and I appreciate all the emails. I can't respond to everybody that sends me an email. I get a lot of emails, but I do read like 99% of them. Okay, I really do try. I just don't have time to respond to everybody. So thank you for all your kind comments. Again, a lot of great feedback on these healthcare videos. A few corrections as you go through this series. And those of you who haven't watched them, I have a playlist, all right, that you can go through and you can look from day one. You can just go through and watch all the videos. Just a few small corrections, adjustments, little things I want to add, tidbits that I just couldn't fit into the video. The first one is about the surprise billing video. That's been by far the most popular one. Lots and lots of millions of views on that one. And the one thing I want to make clear, please call an ambulance if you need one. Okay. That's I should stop. I'm like looking at myself and I should look up here. I'm looking at I'm like as if I don't look at myself enough filming all these videos every day. All right. I'll try to look more at the camera here. Just tell me if I make a stupid face or something. Um, the surprise billing video. Yeah, first lesson for y'all. Okay, yes, please, if you need an ambulance, like call an ambulance. I posted that video, and my I realized later on I was like, wow. What if people see that and they're like, "Oh, I'm not going to call an ambulance." That is not the point. I'd rather you live a wonderful, healthy life, and if that means calling an ambulance because you had some devastating accident or injury, please do so. It Although, you could get a giant bill in the US, we want you to be alive. I really do feel strongly about that point. Um, and I wanted to also go into a little bit more depth about what the bill is. If you get a bill for an ambulance, exactly what is that? Because it could be a surprise bill where your insurance company considers it out of network. That's very common. As I mentioned in the video, I mentioned it was like $1,200 in the video. The average is really more like $400 or $500. If you're getting a giant bill like thousands of dollars, it's probably because you have a high deductible. So I want to make that clear as well. Although surprise billing for ground ambulances is still happening and it's still a big problem, um, uh, don't mix that up with your deductible if that makes sense. But it is, I think, the reason that video resonated so much is number 1 because I'm wearing like a flight suit that has flight ophthalmologist written on the side of it, and it has my name on it too, Dr. Glockenflecken, flight ophthalmologist. I might be the first unofficial flight ophthalmologist in the world. I don't know if anybody's ever called themselves that. I'm happy to make history. This is great. A lot of people have wanted one of those patches. I'll see what I can do as far as like merchandise. Um, so call surprise billing, call the ambulance if you need one. I feel like I don't need to say that, but I kind of do. um, I really did have a lot of fun. And by the way, the caller is from a prior story. My wife, Kristen, Lady Glockenflecken, had a neck thing, and so I got to. This is what I repurpose a lot of things we already have for my skits. And I remember thinking a while back, I was like, should we just throw this away? And I was like, no, no, I might be able to use it in a TikTok. I say that a lot around here. It's a common phrase. So, surprise, and we're going to come back to surprise billing later because I want to talk about exactly what we can do to fix some of these issues. So we're gonna come back to that. Okay, some more corrections, not corrections, but just things you should know, a little bit more detail. The automated claim denials. All right, that came almost completely from that ProPublica article. If you guys have not seen these ProPublica investigative journalism articles, they are incredible. They give us a level of access into these health insurance companies that like we none of us have ever seen before. The amount of detail that they're able to uncover, a lot of it's through depositions because how else are you going to get this information from these health insurance companies unless they're legally forced to provide it? So the video I did about automated claim denials, where based on all the data, whatever we have out there, insurance companies can deny a claim in 1.2 seconds. They do it automatically. Big problem, huge issue. Um, just be aware that that article that I made that video from, it talks mostly about Cigna, although my video is about United Healthcare. So technically, it wasn't United Healthcare that was doing the things that are mentioned in that ProPublica article. However, I I find it hard to believe that they're not all doing automated claim denials. Let's be serious, okay? Because we all know United Healthcare is one of the worst in terms of denying claims, in terms of prior authorizations. So you got to believe that they're also heavily involved in this automation of their claim denials. And I have been told that they also are starting to use artificial intelligence as well in their reviews, denials. So I think I think the point is, although some of the details may come from specific companies, they are all participating in this system. Cigna, United Healthcare, Blue Cross, the other one, well, it's Aetna. So it's a problem. I think they're all just trying to one up each other and see who can be the most evil. So anyway, automated claim denials. If you read the article from ProPublica, it's about Cigna, even though my video has United Healthcare, and that's partly because I already have these established characters, right? I have United Healthcare. Jimothy works for United Healthcare, so poor Jimothy, by the way, you guys, he is poor guy. He needs a new job, doesn't he? I don't know why he still works there. I say this as if I am not fully in charge of his career arc, but still, he's going through it. So everybody, just some thoughts and prayers for Jimothy, please. Well, yeah, you guys are right. Poor Jimothy. Um, Yeah, you guys are commiserating with Jimothy. Thank you. Okay, some more little things I want you to know about the videos that I've made so far. Also, payment. The one I did today, payment processing fees. So I wasn't able to get this in the video because I was trying to make it short because people don't have a real long attention span. Although I have a feeling that most of you who are here would probably watch like a 10-minute video of mine if I had the attention span to make one that was 10 minutes. Anyway, excuse me. Um, so payment processing fees, I would watch 7 hours of Jimothy. Okay. Um, Good. That's a good content idea. I will think about that. What would that be? Just Jimothy, just drinking alone. Jimothy crying into a bowl of cereal. I don't know. I don't know what would Jimothy do for 7 hours. It's a good idea though. Okay, I'm looking at the chat here. You guys, you guys are so funny. Jonathan versus Jimothy debate. There'd be not a lot of talking there on behalf of Jonathan. Hey, if you guys have keep giving me content ideas too. If you have ideas for good videos, I'm always eventually this series is gonna end. I'm gonna have to go back to like, doing my normal like, medical, I don't know, talking about LASIX and rounding. I don't know. Teeth. Anyway, I'm trying to say something here. You guys are distracting me with your awesome comments. Does anybody know how old he is? Me or Jimothy? We are both 37 years old. I know I might look a little older than that. I realize it. I got a lot of smile lines. People like to point that out to me. Just keep in mind, I have had cancer twice and a cardiac arrest. It tends to do a number on you. It stresses my telomeres, everyone. So just cut me some slack. All right. I know I don't look a day older than like 46. Let's how about that? Those weirdos says I liked seeing the payment processing issue, seeing the not consumer facing challenges is interesting. Yes, and that's why I wanted to do those. Honestly, we could do like a whole month on just issues that patients see. But it was important for me to also highlight things that are behind the scenes that are not just patient care issues, not patient care, but patient facing issues, because all the things that are behind the scenes, things like pharmacy benefit managers, payment processing fees, physician hospital ownership, all of these indirectly affect patients. All of this affects patient care in some way or the other. And so I wanted to highlight those things that are not readily apparent to the general public. I think that's really important, but they still affect all of us. So the payment processing fees, uh, I I I mentioned that that's coming from the United Healthcare in the video, but also there are these middlemen because every aspect of the U.S. healthcare system has to have a middleman, and so there's these payment processing fee companies that they mentioned one. I linked to the ProPublica article that I based that payment processing video on, and it does talk about those middleman companies that are between the physicians or the medical practices, the hospitals are receiving payment and the health insurance company. Because if there's any way for someone to insert themselves and extract money from the healthcare system, they're going to find it. And so those payment processing fees benefit both the health insurance company and those middleman payment processing companies. So I didn't mention them just for just simplicity of the video, but they're a huge part of it too. Please read that ProPublica article. It's in the description of the video I posted this morning. Um, those are the big ones. We got some really great topics coming up, you guys. Where it's I'm going to talk a little bit more about pharmacy issues. So I'm gonna address PBMs. I might repost a couple of older videos because I have a video on PBMs that I made that honestly I don't think I can better explain PBMs than I already did in a prior video, and it's one of my favorite videos. So I might post that one again as well, to set up a video after that about DIR fees. I'm not going to try to explain DIR fees to you now. You'll just have to wait for the video, but that's coming because that is a huge, huge issue in pharmacy land. And that the pharmaceutical industry in general, all the way from the companies that make the drugs, all the way down to the pharmacies themselves, that is a black box for a lot of people, both physicians and people that are not in medicine whatsoever. We just don't get exposure to that kind of thing. So I wanted to do a little bit more about pharmacies, about some of the issues that they face, particularly with PBM. So be on the lookout for that. Um, I got a video in a couple days about price transparency, looking at the CMS's price transparency rule and whether or not it's actually being uh, followed. Spoiler alert, it's not. So I'm going to be talking about that. Just some really, hopefully, some interesting stuff. Some more characters too. Neurology. The nephrologist is going to make an appearance. Very excited about that. We've already seen ortho. We're going to have. I mentioned the neurologist, rural medicine, uh, the pharmacist, obviously. Yeah, we'll see. I got. There's gonna be some fireworks. Someone mentioned multiple sclerosis. Well, get ready. You're going to enjoy tomorrow's video if you have multiple sclerosis or have a family member you know or a friend that you know with multiple sclerosis who struggles with all the financial implications of having that disease in the U.S. healthcare system. Let's see. Drake, BJJ, knowing what you know about U.S. healthcare, what would you still have gone through medical school? That's a great question. People ask doctors that all the time. Would you still do it? Would you still be I you know, I am more pessimistic about the US healthcare system, but I am not more pessimistic about being a physician. In fact, I am very glad that I'm a physician because I now have the tools and the information I need to try to make it different, to change things. And that's a big part of why I I've never even thought about quitting medicine. And so I still practice 4 days a week, which for an ophthalmologist, by the way, that's full time. I practice 4 days a week, and I love being able to have this platform and using the things that I've learned both through my job, but also by learning from all of you, from my colleagues about the healthcare system to make these videos and to try to educate and through that hopefully make change. And so, yes, I would still go through med school because I like being able to do this. I like having that background and I don't know. I'm not like sitting here trying to tell you guys I'm like an expert in like health policy or I'm some kind of Nobel Prize winner. All right, I know I'm just making comedy videos, but uh, it's cathartic for me, and I've knowing what I the emails I get, the messages I see, people really appreciate it, and so it's like a way that I can try to make a difference, and so that's why I'm glad I still went. I'm still glad that I went to med school despite all the problems in the U.S. healthcare system, because a lot of people need help. This system needs help. This country needs help. Let's see what else we got. 10 minutes of Jonathan would be a tremendous challenge for you, something to work up to. 10 minutes of like a video, a 10-minute video of Jonathan. I've thought about tell me if you guys would like this actually. Thank you for that. I know you guys like the neurologist and Jonathan back there. They're always watching over me. Two very different people. Still the same person, but you know what I mean. Um, but it's funny you mentioned 10 minutes of Jonathan. I thought how like on Netflix around the holidays you have like a video of like a fireplace, and it's like a crackling fireplace. You can put it on the TV, and it's just like a cozy environment. Um, I thought about maybe doing that, but just instead just having Jonathan sit there and nod at you like every 5 minutes. Would you guys watch that on the holidays? Would you watch like Jonathan just sitting motionless with his Jonathan face? sitting next to a fireplace, a crackling fireplace in a log cabin, receiving you can, like you do whatever you want around the holidays. You're cooking, you're opening presents, whatever, and you just look up every now and then at your TV, and you get a nice little nod from Jonathan. I I think I think it would, like, really make the holidays something special. Alright. I think you guys like that idea. Alright, good. I'll consider it. Let's see, we got some, let's see, a few things here. 747 people here. Thank you for being here, you guys. I don't know what the most I've ever seen on one of these lives is, maybe around 1,000, but this is pretty good on a Saturday. I know you guys probably have lots of better things you could be doing right now, but I'm glad you're here. Thank you for being here with me. Let's see, make a video series about Jimothy discovering healthcare in other countries. Not a bad idea. Um, Crafts for others. My late husband had to be life flighted. I paid out of pocket max 7,500, but then got the life flight bill. It was 48,000, but insurance only paid 5,000. Yeah, yeah. I'm really glad that the No Surprises Act did cover life flight or air ambulances, what they call it. That's a good thing because those bills are astronomical, and so if you're sick enough, if you're injured enough that you need a helicopter, there's no way in hell that the patient should pay a out of pocket expense. Not should not pay an out of network fee for that. That's silly. I mean, honestly, you shouldn't pay anything for that, but our healthcare system kind of is what it is in some respects. Let's see what else we got. Some other. Thank you for those questions. Let's see what else. I think we got somebody else here. Here we go. Nurse Reed RN tips on how fellow healthcare workers can make commentary or comedy content about injustices like you without worrying about legal actions. Yes. If you have noticed, I get this question a lot. Uh, have you been sued, or has have any of these companies come out to get you? Because I have directly addressed several different companies. I've even used their logos in some of my content. Obviously, United Healthcare. I have mentioned Cigna by name, Aetna. I even used Aetna's logo. Even some publishing companies as well. I'm going to be using HCA, which is a big hospital corporation that's coming up in a couple days. Um, I No one has ever come out after me, and I think what protects me is the comedy aspect of it. So, Nurse Reed, RN, you said, how do you can make commentary or comedy? I think the key is comedy because whenever you're producing satire, you do have some legal protection from for it being satire. I always think of you guys watch Nathan For You. He did the dumb Starbucks episode, and he talked a lot about satire protecting you from like copyright law. And so I do think maybe that's protecting me, but also maybe I'm just like I'm like small potatoes compared to these billion-dollar corporations, right? So they I think they in fact I know that they are aware of what I do, but they probably just don't care because they don't think that I'm like worth their time. I'm trying to change that. I'm trying to make me and make us and make this worth their time. That's the goal. So anyway, it's like sledding uphill. That's what it feels like. But keep doing it. All right. So another question that I've been asked, and we're now 34 minutes into this, so I'll kind of to wrap this up before too long. I'm sorry I couldn't get to all of your. There's like hundreds of questions in this chat. I got to do this. I probably say this every time. I got to do this more often, right? I got to do these lives more. This is fun. I'm enjoying it. Um, okay, what do we do about it? I've seen that probably on every single video I've posted this month. What do we do about it? All right, this is and which is a fantastic question. So it starts with education and stories. Okay, that's what I'm doing now. That's what you all are doing when you comment or when you tweet or post on Instagram or make TikTok videos or YouTube videos. When you tell your own stories of the healthcare system, you're helping. It helps because it doesn't matter how many followers you have, somebody is seeing that. It may not be very many people. That's okay. Someone's seeing that and someone's relating to that. And someone's saying, "Oh, they have the same experience I did." And then that person's gonna tell a story. All right, either on social media or to a family member or friend. And then they're gonna tell, and it just keeps snowballing. And so it doesn't matter how big your following is, what kind of platform you have, tell your story. I do it all the time. I'm always telling my story. When I go speak to different groups, conferences, whatever, I'm always telling my story. So it starts with storytelling, and by virtue of doing that, education. All right. Teaching each other, taking the things that you've learned from my videos and telling people that you know. Because the more we all know about these hidden parts of our healthcare system, whether it's PBMs or payment processing fees, like the more we learn, the more the public is aware of it, the easier it is to gain momentum to enact change. And again, I'm still looking at myself. Like I'm like I gotta look at you guys. I just it's the life of an influencer. We just look at ourselves all the time. I hate that word influencer. Am I an influencer? God, I guess I am. Anyway, I'm trying to influence you all right now, I suppose. Um, so education, storytelling, and beyond that, we have to actually make change, right? We have to make the system better. And so that is still best done through legislation, through advocacy, through lobbying. But that still starts with education. We need to educate the lawmakers because most of them do not have a background in medicine. Most of them, I would say, know very little about the healthcare system. Some of them do. And hopefully the others are trying to educate themselves about it because it's a big part of our lives. And so writing letters, emails, if you get a chance to advocate in person, going to town halls or debates or whatever it is around election season, and don't take for granted, don't take your own knowledge for granted and assume that everyone else knows the same thing because they may not. And so you had an issue with a prior authorization that's egregious. All right. Tell your representative, however you want to do it. Call them, write an email. All right. We need to be in their ear. We need to be in our representative's ear about all of this stuff over and over again. That's why talking about it on social media, spreading the message will just get more people likely, even if one person out of every thousand actually contacts a representative. Well, if we get 10 million people who know about payment processing fees, that's a lot of people talking to their representatives. So we got to educate them so they can do what they do to pass legislation and make changes. Specifically, I think the things that we can focus on, because there are a few things that you've seen in my videos this month that are just right there for us to change. One is the ground ambulance coverage in the No Surprises Act. People are already working on that. All right. That's a place that we can make change. Um, prior authorizations, you're going to see more about prior authorizations. A total abuse of the prior authorization process is happening across all of these health insurance companies. We've talked about it before already with automated claim denials. All right, just flat out denying all the claims, as many as possible, to send to review, which are then being denied again. All right. Only 5% of denied claims are appealed. Insurance companies know that. That's why they're denying all these claims. They know people either are apathetic or they just don't have the knowledge to be able to appeal these denied claims. We have to reform the prior authorization process. That's another thing you can talk to your representatives about. On the pharmacy side, PBMs are just destroying everything. And most people don't know what PBMs are. Stay tuned for some comment about that. I'm going to be talking about something called DIR fees, which some legislation has already scaled back on that, but it's not enough. It's killing, these fees are killing independent pharmacies, pushing everybody to these big CVS of United Healthcare mail order pharmacies against their will, essentially. So stay tuned for more on that. Those are physician ownership of hospitals. All right. Now, some of you, I heard some comments like physicians shouldn't be owning hospitals, but who better to like guide healthcare than people who do healthcare, right? Right now, it's health insurance. It's United Healthcare is owning hospitals. Private equity groups are owning hospitals. Why? Why they've never taken care of patients. They actively try to keep us from taking care of patients. It makes perfect sense to me for physicians to be able to own hospitals. Yet the Affordable Care Act, there was lobbying done on behalf of these large hospital corporations to limit physician ownership. That's something that can be changed, and people are working on that. So there are these things happening. All right. Coming out here though, and I know I'm going long. I'm so sorry, you guys. They're like 45 minutes, 41 minutes into this. And so I apologize. This hasn't been very funny. I'm so sorry, but I want to just get this out there. Um, what was I going to say? Physician ownership, United Healthcare. There, we need all of these problems are being worked on. I know what I was going to say. It's really easy, and it drives a lot of engagement to just say universal health care. That's what we need. That's what we have to fight for universal health care. That's fine. That's fine. Yes, everybody should have affordable health care. I I want to try to be as realistic as possible with this content. And while we're trying to work towards something like universal health care where everybody has affordable health care in this country, which is where we need to get, there are lots of little steps along the way that we also need to devote our time and attention to. All these things I've talked about, all the subjects of these videos. All right. So, yes, we can work toward affordable health care for every single person in this country, but we can't just ignore some of these other very tangible, very these issues that are a little bit easier to attack and to change in the short term. So just keep that in mind while we're all working toward our goals. Oh man. Whew. Okay. Sorry about that. As we got 800 people on here now. That was what a fantastic turnout. I want to thank you all for being thank you for letting me get on my soapbox and talk about this stuff. And I'm happy to hear other points of view as well. I just it's making me angry. It's making me angry. So let's all have a wonderful weekend, okay? I feel like I have been doing a better job of actually talking to the camera the last like 10 minutes or so. So, hi, everyone. Let's have a wonderful weekend. You're going to get the neurologist tomorrow. That's going to be a little minor win. Bartholomew Banks, private equity, might be getting his comeuppance pretty soon. So there's going to be some triumphs in this series amidst all the uh, depressing failures. So I try to keep it upbeat, and at the end we're going to have something fun. And so we might do another live at the end of the month. And so thank you all again for watching all this content and supporting me, supporting the video, support each other, support people trying to make a difference in healthcare because there's a lot of people out there doing it. A lot of people are doing a lot of grunt work. I'm sitting in here, I'm making videos, I'm like wearing costumes. Lots of people are going places and really having tough conversations and negotiations with these companies. And so support them, support lawmakers who are who know a lot about this stuff. Educate your own other lawmakers and get your stories out there. All right. Thank you all for being here. That's all I got for you. I'm sorry if I didn't answer your questions, but we'll do this again. All right. We'll see you next time. Bye, everyone. I love you guys. Take care.